Ligaments of the uterus. So here is a simplified diagram with ovaries, the fallopian tubes and the uterus. Now first we will look at the ligaments of the ovary. So there are two ligaments of ovary. First ligament connects the ovary to the lateral uterine wall and the other ligament connects the ovary to the pelvic wall. The ligament that is attaching the ovary to the lateral uterine wall is called the ovarian ligament, and the ligament that suspends the ovary by attaching it to the lateral pelvic wall is called the infundibulopelvic ligament or the suspensory ligament of the ovary. Now the major thing to remember is that the ovarian ligament does not contain the ovarian vessels. In fact, the suspensory ligament of the ovary contains the ovarian vessels. Now, since the suspensory ligament contains the ovarian vessels, it is ligated during oophorectomy so that there is minimal bleeding. The other thing to remember is that the ureter courses posteriorly to the suspensory ligament. So while dividing the suspensory ligament, one must take care that the ureter is not damaged, because damage to the ureter will ultimately cause hydronephrosis. Now we come to the supports of the uterus. Remember that there is a huge ligament called the broad ligament that attaches the uterus, the fallopian tubes and the ovary with the lateral pelvic wall. So this orange ligament is the broad ligament connecting the uterus, the fallopian tubes and the ovary to the lateral pelvic wall. Now comes the cardinal ligament. The cardinal ligament, here in blue, connects the cervix to the lateral pelvic wall, and this cardinal ligament contains the uterine vessels, that is the uterine artery and the uterine vein. So the major thing to remember is that the cardinal ligament contains the uterine vessels and the suspensory ligaments contain the ovarian vessels. Now there is another ligament called the round ligament. The round ligament basically originates at the uterine horns and then exits the pelvis via the deep inguinal ring and passes through the inguinal canal and continues on the labia majora. The only thing to remember about the round ligament is that it is the ligament of the uterus that passes through the inguinal canal.